Nearly 40 years, Liang Shihan has questioned a persistent paradox in Singapore's healthcare system. Why do citizens pay more for care even as the nation's reserves grow? Singapore's model is often praised for its efficiency and low public spending, yet many families feel the pinch of rising medical bills and insurance premiums. This tension between a fiscally healthy state and financially anxious citizens lies at the heart of Liang's writing. He calls it the surplus society syndrome, where national prudence outpaces compassion. In this video, we'll trace the evolution of Singapore's healthcare policies, from the founding ideals of self-reliance to today's dilemmas of affordability. We'll see how each reform, while stabilizing the system, has also shifted more responsibility onto individuals, leaving many to wonder if their savings will be enough for sickness and old age. Singapore's healthcare financing is built on the 3M framework: MediSave, MediShield, and MediFund. Introduced in 1984, MediSave required workers to save for their own medical expenses, marking a shift from tax-funded care to individual savings. This system encouraged thrift but also tied healthcare access to employment history and income. As MediShield and integrated shield plans emerged, risk pooling and private insurance became more prominent, but so did rising premiums and capped benefits. Hospitals were restructured to operate like businesses and subsidies became tiered. Liang Shihan warned that this approach institutionalized inequality. When your CPF balance determines your care, your wage history becomes your health destiny. Despite reforms, the government's share of healthcare spending has remained well below international averages, leaving households to shoulder a significant burden. Singapore's population ages, healthcare costs have soared. By 2030, 1 in 4 Singaporeans will be over 65, intensifying pressure on both hospitals and households. Despite economic growth, the government's share of healthcare spending hovers around 44%, far below the OECD average. Out-of-pocket expenses and insurance premiums continue to rise, while MediSave withdrawal limits remain capped. Liang Shihan's analysis highlights a fiscal mirage. While the state accumulates surpluses, much of the healthcare funding still comes from citizens' own savings and premiums. Even preventive initiatives like Healthier SG, launched in 2023, risk shifting responsibility onto individuals rather than addressing systemic affordability. Liang's proposal to use just 1% of investment returns for healthcare could rebalance the system, easing the burden on families without threatening fiscal stability. The question remains, will Singapore choose greater compassion over continued caution? Singapore's healthcare journey reflects a remarkable balance of fiscal discipline and social stability, but also reveals a blind spot for moral balance. Each policy reform has brought greater efficiency, yet often at the cost of emotional security for citizens. Liang Shihan's message is clear: transparency, fairness, and empathy must guide future reforms. His critique of fiscal mirages, surpluses built on citizens' savings, remains deeply relevant. Future of Singapore's healthcare lies not in accumulating more reserves, but in using public wealth more visibly for public good. A healthy nation must balance its books and its heart, ensuring that no one faces illness with financial fear. The challenge ahead is to create a new social compact, one where collective wealth truly supports individual well-being.